what to expect at your hair loss consultation. Hi, I'm Sue. I run Tudor Hair Clinic and I treat all types of hair loss. So as with any consultation, I start by taking your personal details. So name, address, phone number, the doctors you're with and an emergency contact. Then we'll go through your GDPR, so how would you like to be contacted, and if we can use photos for any marketing purposes. The next step is a medical questionnaire. Now we do need to ask these questions because there are some types of medication that you can't be on to have this treatment. So if you're on blood thinners, if you suffered anaphylactic shock in the past, or there's a whole host of different things we'll go through just to make sure that you're suitable and healthy enough to have the hair loss treatment. Now the next step is to go through your hair history. What products have you used before? What treatments have you used before? And then I'll also ask questions such as, is there any hair loss in your family, your mom, your dad, grandparents? Because as many of you know, hair loss can be a genetic factor, which is why some lads and women lose their hair at a very young age. So we'll go through your routine, what shampoos you're using, how often you shampoo, and asking you all these questions just to get a whole hair history to kind of determine why the hair loss is happening, when did it start, and how long has it been going on. This can help me determine what is the cause of the hair loss. Now most common it is male or female pattern hair loss, but recently I've had people have medication hair loss, a lot of weight loss hair loss, because a lot of people don't realise that when you lose weight that's a stress on the body and it will affect your hair, and normally 3 to 6 months into your weight loss journey you may start to see your hair falling out. So if you know you're on a weight loss journey, then start doing things to prevent the hair loss. Anyway, back to the consultation. So once I've got your personal details, we've done all your medical history, we've got a whole hair history to understand what's been going on and why you may have the hair loss, the next step is the scalp scan. Now a scalp scan involves a microscopic device placed on the scalp to have a real close-up look at what's going on with the hair. And what I'm looking for here are any signs of life, any signs of an active follicle. An active follicle can produce a hair. A dormant follicle can still produce a hair if there's still oil activity or a perfect circle that I can see on the scalp. Now, over time and as time goes on, the longer and longer you leave your hair loss, you are prone to scarring. So eventually the follicle will give up and it will be replaced with scar tissue and then it's gone. If it gets to the scarring stage, then the only answer is a hair transplant. Now what I want to do is get everyone before that happens. If you're just starting to see hair loss, that little bit coming back here, that little bit of thinning at the back, ladies, as we go through menopause, get a little bit older, the parting, can you start seeing your parting a bit more? Is it separating a bit more? That is when to get treatment, because prevention, as we all know, is always better than cure. So start early. I have got a guy that's had hair loss many years ago, but more than likely his hair has been going in and out of dormancy and hasn't been fully dormant all that time. Now there probably are some follicles that have completely gone and we won't be able to revive them, but overall the vertex, the crown of his head is really coming back through again. So it's a great result for someone who's had hair loss for such a long time. So it's hard to know yourself without a scalp scan, without a consultation, to really understand why the hair loss is happening, how long it's actually been there, and if treatment can actually work for you. So now you know the consultation process, you know what's involved, and you know what happens in a scalp scan. Don't leave it too long to treat your hair loss. As soon as you see those first signs of thinning, of receding, go and get it treated. Well, that's if you want to keep your hair.